Clarithromycin, Biaxin, uses, dosage, side effects, and precautions. Clarithromycin is a widely used antibiotic that belongs to the macrolide class, effective against a variety of bacterial infections. Commonly prescribed for respiratory, skin, and throat infections, it is also utilized in treating stomach ulcers caused by Helicobacter pylori. A quick highlight of its benefits includes its broad-spectrum activity against bacteria and its ability to be used in patients allergic to penicillin, offering an effective alternative for many. What is clarithromycin? Clarithromycin is an antibiotic from the macrolide family, often sold under the clarithromycin brand name Biaxin among others, and is used to combat bacterial infections. It is a semi-synthetic derivative of erythromycin, designed to be more acid-stable and effective against a wider range of bacteria. Clarithromycin is recognized for its role in treating infections when other antibiotics may not be suitable. Its classification under the clarithromycin class of macrolide antibiotics means it works by inhibiting bacterial growth, making it a vital tool in modern medicine. What are the benefits and uses of clarithromycin? Clarithromycin uses include treating a wide range of infections caused by bacteria. It is especially effective against infections of the lungs, like bronchitis or pneumonia, throat, like tonsillitis, sinuses, and skin. Conditions clarithromycin treats: respiratory tract infections, sinus infections, skin infections, e.g., acne, throat infections, e.g., pharyngitis, stomach ulcers, when used with anti-ulcer medications. Secondary uses of clarithromycin: prevention of bacterial infections in vulnerable patients, treatment of Mycobacterium avium complex, MAC, in people with HIV, managing dental infections in certain cases. How does clarithromycin work? Clarithromycin works by preventing bacteria from producing essential proteins needed to grow and multiply. It binds to bacterial ribosomes, disrupting protein synthesis. This action slows down the infection and gives the body time to fight back naturally. Since it belongs to the macrolide class, it affects the nervous system of bacteria by blocking their ability to replicate, not by directly killing them, but by stopping their spread. How to use clarithromycin? Take this medicine by mouth, as prescribed by your doctor, with or without food, usually every 12 hours. You can take it with food or milk if a stomach upset occurs. Take this antibiotic at uniformly spaced times for the best effect. This medication should be consumed at the same time every day. The dosage and duration of therapy are completely dependent on your medical condition and treatment reaction. In infants, the dose can also be weight-based. Things to remember before taking: skipping dosage can also raise the risk of more antibiotic-resistant infections. A respiratory illness such as a common cold or flu would not be treated with this drug. If you are allergic to clarithromycin or related antibiotics, you should not take this drug if you have ever had jaundice or liver complications caused by taking this medicine. Clarithromycin dosage. Understanding the correct clarithromycin dosage is essential for effective treatment and minimizing resistance risks. Dosage varies based on the infection type, patient age, and medical condition, always under a doctor's guidance. Typical dosage instructions. Adults, typically, 250 to 500 mg twice daily, every 12 hours, for 7 to 14 days for most infections. Extended-release tablets may be prescribed as 1000 mg once daily for 7 days for specific conditions like acute bronchitis. Children, dosage is often weight-based, and clarithromycin syrup may be used for easier administration, usually twice daily as prescribed by a pediatrician. Take this medicine by mouth, as prescribed by your doctor, with or without food, usually every 12 hours. You can take it with food or milk if a stomach upset occurs. What should I do if I miss a dose of clarithromycin? If you miss a dose, take it as soon as you remember unless it's almost time for the next dose. Do not double up to make up for the missed dose, as this can increase the risk of side effects. Skipping dosage can also raise the risk of more antibiotic-resistant infections. What happens if an overdose occurs? An overdose of clarithromycin can lead to severe symptoms. Consult a doctor if someone has overdosed and has extreme symptoms, such as passing out or difficulty breathing. Otherwise, immediately contact a poison control center. Symptoms of overdose. Symptoms may include severe nausea, vomiting, diarrhea, and abdominal pain. Immediate medical attention is crucial to manage these effects. What to avoid? Avoid taking clarithromycin for viral infections like the common cold or flu, as it is ineffective against viruses. Also, do not skip doses to prevent resistance development. A respiratory illness such as a common cold or flu would not be treated with this drug. What are the side effects of clarithromycin? Clarithromycin side effects may vary but are generally mild and temporary. Common reactions include digestive disturbances and taste changes. Common side effects of clarithromycin. The most commonly reported side effects of clarithromycin include diarrhea, nausea, vomiting, headache, change in taste, stomach cramps, feeling generally unwell. These side effects are usually temporary and mild. Taking the medication with food or milk may help reduce stomach upset. Serious but rare side effects. Though rare, some individuals may experience more severe reactions that require immediate medical attention. Liver issues, yellowing of the skin or eyes, dark urine, upper stomach pain. Heart rhythm disturbances such as QT prolongation. Severe skin reactions, e.g., Stevens-Johnson syndrome. Allergic reactions, rash, itching, swelling, especially of the face or throat, difficulty breathing. Unusual tiredness or persistent fatigue. Stop taking the medicine and consult your doctor immediately if you notice any serious symptoms or if the common side effects persist or worsen. Precautions and warnings. Not everyone can safely take clarithromycin. Certain health conditions and drug interactions must be considered. Who should avoid this medicine? People with a history of jaundice or liver problems from clarithromycin. Those allergic to macrolide antibiotics. Conditions requiring caution. Heart diseases. Long QT syndrome. Kidney or liver disease. Myasthenia gravis. Electrolyte imbalance, e.g., low potassium or magnesium. Are there any age restrictions? Yes. Clarithromycin syrup is usually preferred for children, and dosages are lower in elderly or renal impaired patients. Alcohol or food interactions. Avoid alcohol during treatment. Clarithromycin can be taken with or without food, but taking it with food may reduce stomach upset. Possible interactions with other medications, drug interactions. Clarithromycin can interact with a wide range of medicines. It may affect how other drugs work or increase side effects. Drug interactions may include statins, cholesterol-lowering drugs, warfarin, a blood thinner, other antibiotics or antifungals, antiarrhythmic drugs, for heart rhythm, herbal products like Street John's wort. Always inform your doctor about all medications and supplements you are taking. How should clarithromycin be stored? Store clarithromycin in a cool, dry place, away from direct sunlight. For clarithromycin syrup, refrigeration may be required based on the brand and formulation. Recommended storage temperature. Tablets, room temperature, 20 to 25 degrees Celsius or 68 to 77 degrees Fahrenheit. Syrup, as per label, usually refrigerated. What happens if clarithromycin is not stored properly? Improper storage can reduce the medicine's effectiveness. Always check expiry dates and avoid moisture exposure. Keep out of reach of children. Key facts about clarithromycin. Clarithromycin is usually taken twice daily, or once if using extended-release tablets. Most patients start feeling better within a few days. It's effective against bacterial infections but won't treat viral illnesses like colds or flu. The clarithromycin class includes macrolide antibiotics that work by stopping bacterial growth. Clarithromycin gel is used for skin issues like acne and should not be applied to broken or damaged skin. If you're prescribed clarithromycin under any brand name, Always follow your doctor's instructions carefully to ensure a safe and effective treatment. Whether in tablet, gel, or syrup form, it remains a trusted solution for many bacterial infections. Clarithromycin gel. Gel is an antibiotic used to treat skin infections caused by bacteria. It is used to treat bacterial skin infections such as acne, which occur on your face, chest, or back as spots or pimples. It functions by inhibiting bacteria growth and preventing the spread of the infection. Steps. Gel is intended for external use only and should be used according to your doctor's advice. Until adding a thin layer of the medication, you should usually wash and dry the infected region. It should not be applied to skin that is broken or damaged. Avoid eye, nose, or mouth touch. If you get it accidentally in these places, rinse it off with water. Our symptoms may take several weeks to improve, but you should continue to use this medication regularly. As soon as the acne starts to get better, do not stop using it.